and it's just an enjoyable. It's added to my life. I didn't realize how little I was hearing.
Norma, does yours last for 3 months?
Oh, I've gone 4.
Really? See, that's pretty amazing. You know, most of them is 2 to 3 months, and you come and get a new one. She's 3-4 months, which is really something.
Yeah, but she keeps waiting until the last day.
Yeah.
You're telling her to come in earlier before it quits.
Yeah, you don't want it to stop working like on the weekend. Then you're without it.
Yeah.
But I'm paying attention. I begin to realize too that because like I say, I keep it at a certain level. And if I start asking over, or I'm leaning forward, or I'm doing it, it's starting to go.
Does it give you an audible signal that
Nothing.
it's getting low?
Nothing.
It just goes away.
It's done.
Goes away.
So you're on a cruise
you
ship.
could do proactive removal. If you work for a month and a half, and you're going on a cruise ship, come in and get a new one before you go.
We'll take it out and put a new
You
one
can
in
do
if
that
you're going to be
proactive
gone for a
removal.
month or so.
Oh, okay.
Yeah.
What,
Okay.
excuse me.
Go ahead.
I'm sorry. I'm just curious, where does the wax go that accumulates in the ear when you shower? It usually comes out, or
That's true. The wax is usually made in the outer 1/3 of the ear canal. The lyric goes down beyond that. So when we do a lyric insertion, number one, we clean the wax out that's there. Then we put the device in. The wax glands continue to work, but it's in front of it, so that when the lyric quits, and part of the reason it may quit is due to wax accumulation, but we take it out, and with it comes any of the wax. So patients that thought, oh, I've got a wax issue, this wouldn't work. In fact, it does little or nothing to cause a problem.
I have another question, and it sounds kind of odd, but I wear the Oticon open fit, and until we worked with it and figured out that I had to have a certain type of thing in my ear, I would lose those. They would go down in my ear, and twice I slept on them, and the next day I thought my ear was going to be ripped off my head. And fortunately, we had a forceps, and we were able, because it was on a weekend, we were able to get down there and get this little thing out.
Was it the dome?
The dome.
Okay.
And when I see how far down that is, you know, that gives me pause, because I remember how painful that was. Can anything like that happen with this device?
Well, that's one good reason for going through a trial period with it, to see, because not everyone can wear the lyric. Some have a hard time with anything down that deep in the ear canal. So I would compare it to getting contact lenses for the eyes. I tried contacts. I can't wear them.
I didn't do good with contacts.
Yeah, I didn't either. Can't wear them. So I wear regular glasses. So you may be someone who needs to stay with a more traditional device. But I have patients who thought they were going to have a ton of trouble. And like Norma, when you put it in, if it's sized correctly, you should literally forget the thing is in your ear after.
So it shouldn't give you any...
It shouldn't give you ear pain. Having said that, though, some people's ear canals are too narrow, too short. They have certain ear conditions that you just don't want to put something in there and close the ear up a bit. So.
Well, I learned to look to make sure the dome was still on the end when I take them out every night.
Yeah.
Yeah.
Definitely.
I just thought too, the first time I got one, I did have to come back and have the size changed. And I don't remember what size I wear now, the small, medium, small, because one part's small and one part's large.
That's right.
Yeah, but it's very important that that sizing is correct, and that's the trial period really allows us to work that out. So
Yeah, I'm glad you brought that up, Norma, because your question's a good one. There's a thing called migration. Sometimes we might start off with a small medium, and that might not be big enough. We might have to go to a medium. But you always try to find that sweet spot, and once you get there, it's really it's nice in there and around the ear canal nicely, and then. But you might have to try different sizes to get it right.
There's a comfortable spot for it.
There is.
It isn't like you've got something really foreign there. You've got a comfortable spot, and once you find it and it stays there, like I say, then you've got that little pocket that it always goes to.
That's right.
And so I know the last time I got one, I said, a little bit too far, so you just pull a little bit, there it was.
Mhm.
And I knew that's where it's been ever since. I guess 3 months ago.
You better get one today.
Yeah, you got a question?
I was wondering about the material that's in this. Is there any mercury in them at all?
No, not that I'm aware of. The little yellow flanges there are made of a surgical grade.
Antimicrobial.
Yeah. Yeah, these have been thoroughly tested for years in people's ears to make sure that there would not be an allergic reaction or...
Is there a good, when you said that some of them are made in Vietnam now, do you have a good control over that as far as materials that are being used? I mean, we hear so much about things coming out of China.
Yeah,
So,
that are toxic.
Right, yeah, and so my concern would be, if it's coming out of Vietnam, is there a good control on that, quality control?
Yeah, these are, this big company that bought our company
Uh-huh.
has been using this facility and their engineers for many years. So when they bought us, that was actually a good thing because we get to be part of these world-class manufacturing areas and their engineers, as well as here in domestic, in San Francisco and so forth. So we make the seals here in San Francisco, then they kind of put the battery together, and then they make the sizing up and so forth. And a lot of the new ones, now we have a new one coming out, April, I keep promising them, Lyric 2, which is much smaller, even more comfortable.
Do I get it?
You get it. And see, because like if you come in July, you're probably going to have it.
Oh,
And
okay.
but you may not want to get it because your size is pretty good now.
Uh-huh.
But so this is all good, but good questions.